Hi there. Welcome to Anonymity 1D. My name is Alex. My son Miguel was recently diagnosed with type 1 diabetes.
My name is Lisa, a diabetes educator. I also have type 1.
And my name is Kelsey. I am a mental health counselor. In this video, we explore the topic of mental health and learn what a mental health disorder is. We also discuss some ways to take care of mental health and signs of when it's best to reach out for additional support from a mental health provider. Please remember that this is for educational purposes only and is not meant to replace your doctor or care team.
Hi, Miguel. Hi, Alex. Miguel, are you done with school for the day?
Hi, Lisa. Yeah, school's all done.
Lisa, nice to see you again. Were you here for another presentation with the school nurses?
Yes, but not by me. My friend gave the presentation. This is Kelsey, a mental health counselor.
Hello, everyone.
Hello.
Miguel, the last time we met, things were still quite new for you. How are you doing now?
Okay, I guess.
There are good days and bad days. Some days, he is just fine with getting the injections, and other days, he really struggles with having to do them and everything else that comes along with diabetes.
Diabetes is hard, especially in the early days of a new diagnosis. You've had so many big changes happen, and both you and your dad are learning a lot about this disease. It's okay to have some moments of struggle.
But I don't want to feel like I'm struggling forever. And diabetes is here, forever.
While type 1 diabetes is a chronic health condition, feelings don't last forever. Right now, things feel tough. And that's okay. You are figuring out new ways to take care of your health, and this will start to feel more natural over time.
Oh, so I won't always feel like this?
People can have all kinds of different feelings and reactions to life with diabetes, and each person's feelings and reactions can change over time. It's totally expected to have moments of struggle with diabetes. Sometimes people feel really scared, angry, sad, or confused when first diagnosed, and even in harder moments with diabetes later on. All those feelings are normal too.
Lately, I've been feeling more scared and confused about it all.
It's really great that you can tell when you are feeling scared or confused. Checking in with how you are feeling is an important part of taking care of your mental health. Just like how we check in with our bodies to see how our physical health is doing, we can check in with our minds to see how our mental health is doing. Mental health can include what we think, feel, and do, also known as our thoughts, emotions, and behaviors, and how they are all interconnected. Everyone in the world has mental health, because we all have minds that guide us in what we think, feel, and do.
Wow, I didn't know that everyone has mental health.
Yup, we all do. Another cool thing about mental health is that it's connected to physical health and can play a big role in diabetes care, so it's important to find ways to support mental health too.
That is cool. I want to tell my friends about this and ask if any of them had known that everyone has mental health. Dad, can I run over to the playground for a bit before we go home?
Yes, you can, Miguel. Kelsey, I would love to chat with you some more if you have some time.
Sure, I'm happy to chat more.
Kelsey, you mentioned that everyone has mental health. So, how can we know when a struggle with mental health is actually a mental health disorder like anxiety or depression?
Alex, that's a good question. It may be useful to think about mental health on a spectrum. We can all experience difficult thoughts, emotions, or behaviors throughout life. When those thoughts, emotions, or behaviors consistently impact daily functioning and cause major distress, we call those mental health symptoms. Each mental health disorder has a unique set of symptoms that can show up in a range of severity levels. When mental health consistently causes a lot of distress or prevents us from doing the things that we need to do, like school or work tasks, or enjoy doing in daily life, like hobbies or hanging out with friends, then it may be important to speak with a mental health provider.
Thanks for explaining that. Who is considered a mental health provider?
A mental health provider is a licensed professional with extensive background and training to diagnose and treat mental health disorders. Examples include social workers, therapists, counselors, psychologists, and psychiatrists. Some mental health providers also work with individuals who do not have diagnosed mental health disorders, but who are looking for strategies to enhance their overall mental health and well-being.
That's great to know. How can I find a mental health provider?
You can search online to find local mental health providers or check which providers are included on your insurance plan. Some even provide virtual appointments if you prefer telehealth. Another idea is asking your PCP or endocrinologist if they have a list of recommendations.
Yes, I asked my PCP about mental health providers when I started experiencing more intense anxiety about T1D about a year ago, even as a diabetes educator. Luckily, my doctor had a list ready to share. I looked up the providers and could read their backgrounds and approaches online to find one that I felt comfortable with on my care team. I learned that some providers even specialize in working with people with chronic health conditions, like type 1 diabetes.
I didn't know that. Thanks for sharing, Lisa. I worry a lot about Miguel. He sometimes skips snacks because he doesn't want to take insulin. I am also nervous about his friend's upcoming birthday party. There will be pizza and cake. Plus, it's a sleepover. Those are a lot of things to consider without me being at the party.
Those are a lot of variables to consider. We can talk more about a diabetes plan to help you and Miguel both feel prepared and for Miguel to have an enjoyable time at his friend's birthday party.
I would like that. Even though I know it's possible for Miguel to enjoy the party and have a plan for diabetes, I still sometimes think about the worst-case scenario and then feel stuck in those thoughts. Not just about the birthday party, but other experiences too.
I can help you make the birthday party plan, and you can share it with the parents of Miguel's friend. I've worked with lots of parents of kids with type 1 diabetes who have similar worries. Some have even shared that they reached out to mental health providers to support their own well-being. Finding ways to support your mental health as a caregiver is also important.
Thank you so much. Looks like Miguel's blood sugar is starting to trend down from all that playground fun. Let's continue this conversation over there so I can bring him this juice box.
Of course.
Feeling better, Miguel? Your blood sugar is better now.
I am feeling better now. Thanks, Dad.
Kelsey and Lisa, I appreciate everything you've shared so far. Now I'm wondering what I can do to best support Miguel's mental health, especially when it relates to type 1 diabetes.
Your care and curiosity make an admirable foundation to supporting his mental health. Having an awareness of what mental health is, how it impacts diabetes management, and signs of mental health symptoms are some ways to start. Sometimes it can be hard to talk about mental health when things are difficult, so it is also recommended that you always approach the subject from a place of kindness, non-judgment, and acceptance to encourage open communication with Miguel.
You can also reach out to us, your diabetes care team, for additional support. People with diabetes are at an increased risk of experiencing mental health challenges and being diagnosed with a mental health condition such as generalized anxiety disorder, major depressive disorder, or an eating disorder. Mental health providers can help identify mental health challenges and provide options for effective treatment to help people thrive in life with diabetes.
That's right. We each can also intentionally do things that promote general mental health and well-being in our daily lives, like getting enough sleep, exercising, managing stress, spending time in nature, having positive social relationships, practicing mindfulness, or engaging in activities that are meaningful. All of us can find what coping strategies best support our health and well-being.
Those all sound pretty doable. I've learned a lot today.
I learned a lot today too. My friends also thought it was so cool that everyone has mental health.
Kelsey, thank you for helping us understand more about mental health today. Miguel, are you ready to go home? Don't forget your backpack.
I am glad we got to chat today. Remember that mental health is a component of health that everyone has and includes thoughts, emotions, and behaviors that exist on a spectrum and can range in severity. Diabetes can certainly have its challenging moments. People with diabetes experience unique stressors associated with disease management and have an increased risk of some mental health diagnoses. Just like how blood sugar, ketones, and exercise are all important topics related to diabetes care, so is mental health.
We hope this gave you a better understanding of what mental health means in general and in the context of type 1 diabetes.
Through this playlist, we will learn what mental health is, common mental health challenges that people with diabetes experience, and strategies to support mental well-being. To learn more, check out the resources in the video notes.
Please remember that this is for educational purposes only and is not meant to replace your doctor or care team.
Don't forget to like and subscribe to our channel. Thank you.